Hi, my name is Dr. Patrick Pathappillil. I work in the Department of Internal Medicine, and today I am talking to give some awareness about prostate cancer. Prostate cancer is seen in around 11% of the male patient population, and the risk for it increases with age. Usually, it is asymptomatic as opposed to benign prostatic hypertrophy, where patients have to wake up multiple times throughout the night in order to urinate, and they do have a thin stream of urine. But in prostate cancer, patients are usually asymptomatic unless it has already spread to the bone, and there's like pathological fractures because it affects the density of the bone. And that's usually seen in around 6% of patients with prostate cancer. Usually, the guidelines recommend screening for patients above the age of 50 if their life expectancy is more than 10 years. That means that if they do not have any other comorbidities, the prognosis or the expectation is for that patient to live for more than 10 years. And that the reason why that's recommended is that prostate cancer usually spreads very slowly as opposed to other malignancies or other cancers. So because of that reason, the chances of a patient dying from other conditions is higher as compared to prostate cancer. So it's usually a mutual decision that as the doctor talks to the patient, it's up to them to decide whether they want to be screened for prostate cancer or not. And it also depends on the age, the risk factors, the family history, multiple different factors. Now, how to screen for prostate cancer? It's usually by testing a blood level called PSA, also known as prostate-specific antigen. Now, that can be falsely elevated due to other factors, like if there's like a urinary tract infection, if a rectal examination was done, and due to other factors, it can be falsely elevated. So we recommend if it's elevated, then we repeat it again later on in the next visit. And if it's persistently elevated, then we send the patient to urology, or we can decide whether a biopsy it needs to be done of the prostate to determine if the patient has prostate cancer or not. Sometimes MRI can also be done in order to have an understanding or to have a better evaluation on whether the patient needs biopsy or not. And if prostate cancer is confirmed, then usually we recommend going to an oncologist to see if further treatment is required or what needs to be done in order for addressing the prostate cancer. So that's my take on and a few tips on prostate cancer for today. Thank you.